Good afternoon, everyone. Would like to thank you for being with us today for today's webinar. Just before we begin, as we're waiting for some additional people to join us as we do our introductions, I just want to make sure everyone's aware we're just discussing issues with vaccinations. We're not giving them out. We had over 500 people register. List is still going up, so we're very pleased with the attendance, and we're addressing another serious issue that's facing employers as the laws continue to change. And today we're going to talk a little bit about employee vaccinations, updated leave entitlements, and addressing violations of COVID-19 protocols. In terms of some brief background about myself, Mary Ann and Lauren, and the rest of our department in employee resources at Garfunkel Wild, we've been handling various types of claims, from DHR complaints, EHR, state and federal litigations, as well as employee investigations, handbook preparation, you name it, top to bottom. During the pandemic, we've really focused our efforts on addressing the specific issues related to COVID-19. And one of the reasons for that is, and I think we have a leg up on some others that are doing this, is because we're so close in the healthcare field. Many of our clients historically have been healthcare providers. That has shifted recently. We still have many healthcare clients that we work with top to bottom, but our access to healthcare and those type of clients have really set us apart and put us at the forefront of addressing these types of issues. So with that said, feel free to reach out to us, not only on these topics, but other topics you'd like to see. We really enjoy these presentations. It gives us an opportunity to connect with all of you. Right now, this is the virtual world. This is the closest we can get to you, not being able to step into your offices on a day-to-day basis like we're used to. But if you have topics you'd like to hear about, whether it's the HR field, healthcare, restaurants, manufacturing, food banks, whatever it is, please let us know. Some topics we're considering coming up: OSHA, that's been a big compliance regulatory issue we're dealing with, sick leave, and other day-to-day policies. Now, with respect to today's agenda, laws continue to change. Throughout December, there were several updates to the quarantine policies that had to be put into place. It's very difficult for employers to stay on top of it. Complicating that is the fact that employees think that they know the laws better than you do, and they're trying to tell you how to do your job. And you have obligations to other employees, customers, patients. So it's important that you stay up to date with these as well. Full disclosure, we may give you an answer on Monday, and you come back to us on Friday and say, hey, you told me something on Monday, it's different. That might be the case, that things are changing that rapidly and that quickly throughout. So we'll do our best. Look for us on social media, LinkedIn, Facebook, other venues where we're putting out information, client updates. If you're not on our alerts, please get on there so we can get you the information in real time and share this with others that might want to receive it as well. Today's discussion, we're going to keep it practical and pragmatic, like we have done throughout the pandemic for you. And what we mean by that is we want to answer your questions. We want to answer the topics that are of most interest to you, real life scenarios. We're not going to throw a bunch of statutes at you and legalese. We're going to talk about the day-to-day stuff that we're seeing and that I'm sure you're seeing. With that said, feel free to ask questions throughout. Write it in the question box. We'll do our best to answer. As we said, we've had over 500 people register. It looks like 270 are already online. That number's ticking up, and others will join us through the recording of this. I should mention that we will record this, so if you don't get to catch all of it, you can certainly tune back in at a later date and time to follow up. And just some of the topics for today, we had the big teaser out there, which I'm sure many people want to know, and Mary Ann's going to touch on that in a few seconds. Can we mandate the vaccine for our employees? What are some internal considerations we should have when setting up vaccination policies? Also, what are some of the updates regarding recent COVID leave laws, quarantines, et cetera? And the last topic, which we'll touch on just briefly at the end, but we're seeing a big uptick in these types of questions and issues come to our door, which is how do we go about addressing employee disciplinary issues? People looking to take more time, too much time, and they want to start traveling, and how do we deal with that? So again, we look forward to your questions. Be patient. We've set this up where we'll probably answer most of the questions that you've had. But again, if we haven't, we'll certainly try our best to get to them. Mary Ann.
All right. Good morning, everybody, or good afternoon at this point. My name is Marianne Monroy, and I'm one of the co-chairs of the Employment Law Practice Group. And as Sal mentioned, the three of us handle day-to-day employment counseling and advice, particularly in the area of COVID. So I'm going to jump right in, and the hot topic or question that I'm frequently getting now is, can I mandate the vaccine? Now, a lot of people ask me the question, but they don't necessarily want to mandate it. There's still more of our clients that are looking to encourage versus mandate. But from a practical standpoint, the short answer is yes, you can mandate having a COVID-19 vaccination program with some caveats. And they are really important caveats. So there are both legal and practical considerations and caveats you have to consider. So I'm going to start with the legal issues. And I noticed I did recognize a lot of the names of the attendees, whether the clients or the individual participants, and some of you may have already had this conversation. So hopefully this reemphasizes some of the things we talked about. And this is current as of today. As Sal mentioned, things can change as we go along in the weeks to come. But from a legal standpoint, the big issue we have to consider are some of the ADA and religious considerations, okay? So as many of you know, there are equal employment opportunity laws. They cover a host of things: race, religion, national origin, but also disability, okay? And disability is a big issue because the mandate itself and vaccinations runs closely or parallels with issues of health, right? So to start off with, the vaccine itself and the administration of the vaccine does not come under the umbrella of an improper or a medical inquiry, okay? So employers, as I'm sure most of you know, are not supposed to dig into individuals' medical history or medical background, unless there's some kind of job necessity, and that's pretty limited. Asking questions about a person's health condition and medical background is generally inappropriate, all right? So people immediately ask, well, if I give the vaccine, is that a problem? So the vaccine isn't going to raise or elicit medical information about an individual, all right? Nor would it raise concerns or issues under the ADA as far as asking an employee to provide proof of vaccination. Okay, where you start running into, more questionable areas and problematic areas, so you ask somebody for proof and they don't give you proof, or say they didn't get the vaccine, right? The inquiries about why you didn't get the vaccine then raise and bring you into the realm of the ADA and disability and health inquiries, okay? So, and we're going to talk about that next, but keep in mind, giving the vaccine, not a problem, asking for proof of vaccine, not a problem, but the inquiries related to why you did or did not get the vaccine, or the pre-screen questions, all right? And, most of us are all familiar with, if you've taken a vaccine in the past, somebody's going to ask you a series of questions. You check off a lot of boxes on a form, including health conditions, if you're pregnant, not pregnant. Those pre-screening questions to get the vaccine is where we can run into an issue, and you have to have certain considerations come into place, because those will elicit health information. Now, when an employer requests health information, they're supposed to be job related, it's got to be job related and consistent with business necessity. So if the EEOC and the EEO laws are not prohibiting employees from getting or an employer from mandating the vaccine, by that very nature, there would be some job related requirement to be able to ask the pre-screening questions to give the vaccine. We can't give the vaccine without doing the pre-screening questions. So the things that come up in the best practices would be, ideally, the person who is doing the screening is an outside entity, right? So that the employer does not become privy to protected health information. If CVS comes in, or Rite Aid, or pick a place and they go do the vaccines, you are not going as the employer to find out protected health information, okay? Same thing if you let employees schedule their own appointments and they go to whatever place might be offering the vaccine, other than asking for proof of vaccination, you as the employer won't become privy to health information. But in some instances, employers are telling us, like, look, we're a site that's going to be giving this out. We're a health practice, a hospital, or whatever it might be, assisted living facility. We have the vaccine. We have the providers that can administer the vaccine. So in that circumstance, I understand it makes sense to do it in-house. But if you're going to do it in-house, you really have to have a procedure and a protocol, okay? Because what we don't want to have happen is that too many people are getting information about employees, okay? And that's confidential. Or let's say, and ideally, the person giving the vaccine is not in the same reporting line as the employee getting the vaccine. And why that's important, because let's say I'm screening somebody, I'm a supervisor of a particular employee, I'm screening them, and they have to check off the box, right? And they haven't disclosed it to anyone else. But I'm the supervisor. I now know that that employee is pregnant. Now, as the supervisor, I might also be dealing with a lot of performance issues for this particular employee and getting ready to discipline the person. But now I just got information that they're pregnant, and the next week, after I did the vaccination screening, I give them a disciplinary notice. They might be able to claim, look, you were then aware of my pregnancy status, and I feel that that was, you're using that information to retaliate or discriminate against me. So having the right buffers in place and making sure it's on a need-to-know basis is very important, okay? Let me see. Okay, other things to keep in mind with the screening and administering the vaccination, if you're going to do it on site, a private location, and keep the records secure, right? Now, if the vaccine is not mandatory and it's just being offered on a voluntary basis, the requirement to prove job necessity, right, which is what you have to do to do the screening and administer the vaccine, is eliminated, because then it's voluntary and they can choose whether or not to answer those questions to get the vaccination, right? Now, of course, if they decline to answer the questions, the employer can then say, okay, well, then you don't get the vaccine, and then you move on, okay? Now, still staying on the legal topic, the caveats we have to consider, and I just started the dialogue about the ADA implications and getting health information. You then have to do an assessment for disability accommodations, or whether or not the employee has a reason not to get the vaccination based upon a health condition, as well as a religious accommodation. So starting with disability, okay? And this is the same inquiry that everybody does when employees come in and they're either assigned a task or they have a job duty and they say, well, I can't do it because of a health condition. And you have to engage in that dialogue, an individualized assessment, all right? So employee comes in, you have a mandated policy to get the vaccine, but this employee might have allergies or severe allergies that expose them to potential negative reactions to the vaccine, okay? And I've also seen some comments or literature on perhaps pregnancy. People who are pregnant might not be the best candidates at this point, or lactating mothers. I mean, there's diverse literature out there, but assume you're going to get medical notes for a variety of different reasons where a provider is going to say that employee should not get the vaccine, okay? So now you engage in the dialogue. You have to make sure that the dialogue is documented, and then you have to assess, okay, would an unvaccinated person, and this is the legal analysis here, pose a direct threat due to a significant risk of substantial harm to the health and safety of the actual individual or others, which cannot be eliminated or reduced by a reasonable accommodation. And that last clause is very important. So it's not just whether or not they're going to pose a substantial risk of harm to themselves or others, but is there an ability to either mitigate it or eliminate it, which would allow them to continue working. So for example, and the direct threat, there's a lot of factors that go into it, like how much of a threat would it be? How severe would it be? Is it imminent? What's the duration of the risk? You know, maybe it's someone who comes on site once every other month, okay? So there's a bunch of different factors in making that assessment that you would look at. A back office employee, for instance, that might do billing, has a disability issue that makes them not a good candidate to get the vaccine. There would likely be reasonable accommodations that could be provided to allow them to stay on site with regard to whether or not where their office is situated, PPE, social distancing. It cannot be an automatic assumption that I have a mandatory policy, therefore, if you don't get it, I'm excluding you from the office or I'm terminating you. You have to do the analysis. There's no one size fits all. And you need to then document and have the objective basis for either declining accommodation or in coming up with the various accommodations being offered, okay? Again, direct threat, you can't automatically terminate. I mean, the other thing you might even have to look at is remote positions, okay? So masks, remote positions, social distancing, there are things you would have to consider as far as that if you are going to mandate the policy. All right, with regard to, and let me just see, I think I see a few questions coming in.
There were two I saw, Marianne, that maybe I can pose to you quickly. One was, is there any change in effect on anything you discussed, specifically accommodations for size of an employer, you know, being 50 or less, or related to any size requirements?
Okay, so really it's going to come down to what would be an undue burden on the employer. I do see that people have mentioned a little bit of a sound problem, so hopefully that's being addressed and you can hear me. But going back to the question, the size of the employer isn't necessarily the catch-all and say, well, we're so small, so therefore, you know, we shouldn't have to make exceptions. Now, that might play into it or factor into it, but again, you have to do the assessment. Often the larger practices or larger employers are held to a higher standard. So I've had clients tell me, well, you know, this particular MA won't get the vaccine for whatever reason, and, you know, it would be too much of a burden to allow her to continue working. And, you know, you really have to look at that and say, is that reasonable? Is it not reasonable? Can that person, let's say, actually a better example would be the remote work. You have a big practice and your job can be done remotely. Whether you're a 5-person employer or a 100-person employer, if the job can be done remotely and that's a reasonable accommodation, then that's what it is, regardless of size. So I hope that answers that question.
And related to that, Marianne, in terms of the accommodations, at least, any other particular considerations for our healthcare workers? I saw that question raised by a audience member as well.
So, I mean, so going back to mandating the vaccine, healthcare workers in the healthcare industry, there is definitely a stronger argument than maybe some other employer entities to say, look, there is a real need or a business necessity to get the vaccine, right? So I think you're going to have a stronger argument for the healthcare industry to say, you know, we really need this for business necessity, and or from the perspective of interfacing with patients. But really, I think the analysis is very similar across the board because you have a staff that could be at risk, you know, in any employer organization. So the vaccine is not just to potentially eliminate or mitigate threat to staff or to customers or patients or clients, it's also internally. That being said, I still think that what we're seeing is more of a push to encourage and educate people to voluntarily take the vaccine. And I'll talk about that in a few moments. But I really want to touch, because I know the other speakers have a lot to convey as well. You have to think about religious exemptions. Okay, so I would anticipate, although we really haven't seen much coming in by way of religious exemptions or requests, that is definitely one of the legal caveats. So if somebody comes in with a bona fide religious belief, practice, or observance, and they're claiming that prevents them to get the vaccine, that is something you're going to need to consider. Now, you know, the thing is, a lot of religions I haven't heard of necessarily saying there's a prohibition against vaccinations, but the federal law, more so than the state, defines religious beliefs much more subjectively. So you can't just say out of hand that, okay, you're a practicing X religion and that your religion doesn't ban vaccines. It can have, people can have some more subjective religious belief. And so you're going to have to look into that. It can't be a philosophical type of belief. It can't be that I'm just anti-vaccination, just from a personal standpoint. That's not a religious exemption. But if someone can tie it to a religion and you assess it, you may even be able to ask for, if you have an objective reason, ask for some supporting documentation, because I'm sure, as I sit here today, and many of you, I'm not sure of every religion out there, so there might be some need to get some additional information. All right. Some other issues with regard to if you were to go down the path of mandating the vaccine. From a logistical standpoint, it's very difficult, right? Because unless you are the recipient of the doses and you are administering it in-house, it is not that easy to just say, okay, everybody get it by, you know, February 15th or March 1st, because the availability is limited. Even those who are set up to administer it on site, the availability is limited. So you're going to have a situation that people might be waiting 30 to 90 days or more to get the vaccine. And then you'll have people that are still wearing PPE and masks and everything like that, and they're not vaccinated. Some of your staff will be vaccinated, but your unvaccinated staff who are still waiting, right? They're allowed to work, right? Presumably, even with the mandated vaccine, you're not going to send half your staff home pending vaccination. And why that's important is, on the flip side, if a few people say, well, for religious or disability reasons, I can't get vaccinated, it's going to be very hard to argue that they can't still work on site when you've been letting them work on site for the last 30 to 90 days waiting for a vaccine. That the employer must have thought they can safely do so with masks and PPE and social distancing. So, you know, that's one of the things that we foresee coming up. Also, from an HR standpoint, you have to have the right resources in place to engage in that dialogue and document the religious and disability accommodation requests, and that they're properly handled. You don't want some supervisor just out of hand saying, nope, I'm not giving you that. That disability doesn't count. I don't count it. Also, from an enforcement standpoint, and you want to be consistent. So if you mandate the vaccine, you can't let your superstars who don't want to take it off the hook, but everybody else has to be on the hook, all right? Then the other thing too is, if you make disability accommodations for some in similar positions, you have to make similar ones for others based upon disability. So it can't be, well, I'll give a disability accommodation to these 3 people who are in the same position, but the other 3, I'm going to say, no, I can't give that accommodation. So you want to be consistent with enforcement. You also need to be prepared that you may lose some talent. And that's what we're hearing. A lot of people are polling staff before they implement the mandatory policy to see if they're going to have a little walk off the job. And that is coming up. More often than not, you're going to get people who you would have assumed would have been first in line for a vaccine are saying, no, I don't want it. I know we're getting
just to jump in, because I know we have a lot of other material to cover. We want to move it through. I saw a question that'll pop up about PPE and masks specifically, and just want to make sure we clarify for the audience that just because an individual gets the vaccine, it's not going to, alleviate any other obligations to continue with masks, PPE, if you're in a healthcare setting, social distancing, any other schedules you might have worked out. There's definitely a lot of talk about that, a lot of discussion. In fact, I had someone ask me that very question this morning. And the short answer is no, we're still going to have to abide by masks, social distancing. For one, it seems that you can still transmit the disease. Two, it's not 100% prevention here. So we're still dealing with 95%-ish or around. Some people might have a lesser effect based upon medications that they take. So all considerations, but generally, you're not going to be able to just take off the masks, to be blunt. And, with respect to travel, Marianne, anything to add to that? I know we've had some questions from clients about, oh, well, so now everyone can just travel, right? We're good to go back to Florida and come back without a mask. And the answer there is no again, right?
Right, absolutely. And for the same reasons that you have to still wear PPE and mask, the travel and close contact quarantines still apply because, and even I don't think you mentioned too, there's a ramp up period even for the vaccinations. You might get vaccinated on day, 1, but it might take up to 2 weeks. So the data is saying before you are you have the immune effect that would prevent you or hopefully mitigate you getting the vaccination. And as Sal said, it's not 100%, and it's also not 100% sure that a vaccinated person still can't transmit the disease. So we have been receiving a number of calls saying, well, I got the vaccine or my staff got the vaccine, so I'm going to lessen the requirements to return to work after going, on vacation or out of state or whatever it might be. All of those apply, as well as the return to work policies. Back in June, when everybody was coming back, or a large portion of the employers were bringing staff back to work, they came up with comprehensive plans. You need to follow those, reinforce them, remind people not to let their guard down. The other thing, as you can see on the slide, I wanted to mention too, with mandating policies, remember there's a potential for liability with respect to an adverse reaction. And as of now, we believe that any of those claims would fall under the workers' compensation provisions as far as if an employee has an adverse reaction. But clearly, if you did it voluntarily, then you would reduce or eliminate the exposure because people are voluntarily getting that vaccine. And the last thing with regard to voluntary programs, we have been getting questions about incentives. And, so that is something besides education and management taking the lead and getting the shots and encouraging people to do it. I've heard things from everything from gift cards to actually just, discretionary bonuses and cash and whatnot. So that is something, if you're interested in that, we've worked with people to get the vaccine. And just the last thing I will mention is confidentiality. So from a patient HIPAA protection standpoint, these are not your patients, they're your employees. So it's not a HIPAA issue, but all of the employee confidentiality requirements, they do apply. Medical information about the vaccination pre-screening, separate folders, it should not be disclosed. You should not be disclosing who got the vaccine, who didn't get the vaccine, who's exempt from the vaccine. So I think I covered quite a bit. I will scan for additional questions as my colleagues continue on. Oh, I forgot. I have to talk about one more thing, a potential scenario. So
yeah, I'll throw it out, Marianne or Lauren, when all of us can jump in on it, but the situation I envisioned when we first started talking about vaccines from an HR standpoint was, and we all know that the type of employer that's out there that might say, well, we got to have the vaccine, we got to get it, and that's it. If you don't get it, you can't come to work, period, end of report. And there's going to be employees, when they hear that say, wait a minute, you opened up the office in June. You had me in here every day. I've been treating patients face to face. I'm escorting patients to the room. I'm dealing with customers. I'm in the warehouse. You had no problem with that for 6 months plus. Now all of a sudden I got to go get vaccinated. It doesn't stand up. How are we going to deal with that? What should we be advising clients?
And this will go back to having a proper policy in place, being consistent with your enforcement. And certainly for healthcare providers, you're going to make the argument, look, we want to provide the safest work environment as well as the safest type of interaction with the staff. But on the flip side, Sal, you're 100% right. Everybody has been working fairly successfully, right? with the way you have things in place now, PPE and mask. And that is why we see many employers just saying, look, I'm going to go down the path of voluntary administration and encouragement and education. But if you have this mandated policy, you have a direct threat possibility that you can establish here, and people just don't want to take it, you can arguably exclude them. But you would have to exclude everyone who takes that position, which is a very hard thing for employers to do, to say, okay, you know, I have 5 employees, they're my superstars, but they're not going to take it. You might wind up in a situation where you're going to lose talent. But that is only in the situation where we're not talking about disability accommodations or religious beliefs, all right? And I would anticipate you opening yourself up to increased chances of litigation, because this is a new area, and people feel very strongly about being forced to, you know, take vaccines, and you could see that becoming a subject of litigation. And the other thing I want to say too, just quickly, if people don't take the vaccine, it is important not to share who took it or who didn't take it, because what I would envision happening, and I've spoken to clients about this, is that everybody who knows didn't take the vaccine, people won't want to work with them, right? Or they'll be stuck in the back office somewhere, or get, you know, the terms and conditions of their job will change. You know what, then it's not a voluntary vaccine, then that becomes mandatory, right? If their terms and conditions of their jobs change, and people can find it retaliatory. So just be careful about doing that.
All right, thank you. We still see some questions coming in. We'll continue to review those and get to as many as we can. We're going to switch gears a little bit now, and Lauren is up on some vaccine protocol considerations.
Thanks, Sal. For those of you that don't know me, my name is Lauren Levine. I'm also a partner in the employment group here. And I've been dealing with these COVID issues along with Sal and Marianne. And one of the issues that I thought was worthwhile mentioning that I've been getting questions on is for those employers that are able to get a significant access to the vaccine, what are some considerations when employees are experiencing side effects and symptoms of the vaccine that may be presenting in a way that it's unclear as to whether they are having a side effect from the vaccine or whether they actually have been exposed and potentially have COVID or some other infection that we would want them not to come to the workplace. The CDC has issued some strategies really for Department of Health and for occupational health programs, but I think there are worthwhile tips also for employers to consider as we wait for some more guidance from the state. You know, the major issue here is, you know, we don't want to let people come to work if we believe that they've actually, you know, been exposed and may have COVID, but at the same time, you don't want staffing shortages being caused by the fact that your employees may be experiencing side effects. One thing that has been made clear by the CDC and other authorities is that there are certain symptoms of COVID that will not present as side effects. So if your employee has a runny nose or the cough or the respiratory issues, loss of taste or smell, those are not consistent with post-vaccination symptoms. So there are some symptoms that we can be sure are not a side effect from the vaccine. Some of the side effects that have been coming along with the vaccine that are also symptoms of COVID include the fever, the fatigue, headache, chills, muscle aches, and that sort of thing. So because some of these side effects are consistent with COVID, it may be challenging for you as an employer to figure out how to address that. And some of the strategies that the CDC has put out include how to roll out the vaccine so you can avoid some of those shorting stoppages, you know, that might be caused by giving your staff the vaccine all at once. Again, if you have access to you know, that much vaccine. So some of the recommendations are vaccinating your staff either before a weekend, you know, before they don't come to work for 2 days if they're not a full-time employee, doing the vaccine at a time where maybe they have a couple of days to recover from the symptoms and may not even be presenting with any symptoms by the time they come back to the office. The research so far shows that symptoms really are usually mild forms of the things I talked about, and also they usually end within 3 days of getting the vaccine, including that first day. They are seeing that there are more side effects from the second dose a lot of times, so that's something to be aware of as well. But if you have the ability to, do the vaccine, before a weekend or when staff will have time off, and that way you can avoid everyone potentially having these side effects at the same time. Also, one other recommendation that the CDC made was staggering the vaccine in terms of who you are giving it to. Don't give it to every employee in the same division or the same unit at the same time. If you stagger it, this way you won't have the potential that you have 5 employees in the same unit coming down with side effects, and we can't tell whether we need to exclude them from the workplace because the symptoms are some of those that I talked about that are consistent with COVID, but may also come with the vaccine. It's important that your staff is educated on this too. People, should be notified and advised of these potential side effects so that they can, monitor their own symptoms and be aware of what may be happening. Also developing a strategy to make sure there's a timely assessment if someone has some of those symptoms after having the vaccine. The CDC recommends especially, making sure that your staff have access to testing and potential rapid turnarounds so that we can be sure that a symptom is most likely from the vaccine and not that there's an actual exposure. A couple of pointers, the CDC has made clear that if the employee has symptoms and we know that they've had a close contact or they traveled within the last 14 days, we should exclude them. We should not assume that the side effects are from the vaccine. We should err on the side of caution and assume that there's a potential exposure there. But where healthcare personnel have received the vaccine in the prior 3 days and they have no known contact, and we don't believe there's been a close contact, there's more of a consideration for how you might address those issues. Like I said, all of the suggestions about how to roll out the vaccine, as well as educating those employees and making sure that they have access and are aware of, the clinical judgments that need to be made so that they're not unnecessarily excluded from the workplace when they haven't had, the exposure, and we really believe that these are, side effects from the vaccine. Obviously, as an employer, you're not going to make a medical judgment about your employees, but being armed with this knowledge and having your employees aware of this will be helpful in getting those decisions made quickly. Certainly, one of the other things that the CDC has said is that fever, if an employee has fever, they should absolutely be excluded, even if we know that they haven't had a close contact. But some of those other things, chills and just feeling run down, we may be able to evaluate a little better rather than having a staffing shortage caused by side effects from the vaccine. One other key point that Marianne already made, but is also relevant here, is that staff should be continuing to wear PPE and follow all social distancing guidelines, so we also mitigate the risk of spread when we're not sure whether something's a side effect as opposed to a symptom. We have here setting unrealistic deadlines. That really goes, I want to go back just for a minute to the mandatory vaccination. If you're going to have a mandatory vaccination program, you can't set unrealistic deadlines on your employees, especially if you're not an entity that's offering the vaccine yourself and you're requiring your employees to go out and get the vaccine. With the shortages that are out there right now, that would not be a reasonable way to manage the situation in terms of when employees have to get vaccinated by. And that goes for those incentive programs too. If you're going to create an incentive to get vaccinated, if you set an unrealistic deadline, knowing the shortages that are out there right now, if you're not providing it on site, then you may be turning that program into an involuntary program versus voluntary. So just some other considerations to think about. Costs for time spent receiving vaccine when mandated. You will need to continue to pay your staff, whether it's time spent on premises while they're getting vaccinated or whether you're requiring them to go out and get vaccinated elsewhere. You will need to compensate them for the time they've spent doing that if you have a mandatory vaccination program. One other question we've been getting a lot just in terms of COVID generally and now with the vaccine is, can we require employees to sign a waiver and release if, let's say, for instance, we have a voluntary program and, we want employees to understand, well, you may still be at risk. You're coming into the workplace unvaccinated. We want you to understand there's risks here and we want you to sign a waiver that you're not going to, claim liability against us if you get COVID because you were offered the vaccine and you decided not to do it. Just like as we talked about previously with COVID, any waivers that an employee sign are likely not going to be upheld if they're challenged. We certainly don't recommend those, and we don't believe that they would get you out of liability if your employee's not vaccinated, or if, or if they are vaccinated and if they have side effects, significant side effects, that would likely be covered under your workers' comp, and such waivers wouldn't be enforceable anyway. But what we do recommend is informing your employees, making sure that they are informed about, all of these things we talked about, including, the side effects and, the potential efficacy of the vaccine, and, reasons why the vaccine is important or helpful, and you can have them sign an acknowledgement saying, I've received this information and I either, I've declined, or I'm going to be getting the vaccine, but more of an acknowledgement that they've been given the information and encouraged. Again, this is if we're talking about a voluntary program. So I think educating your staff is really the key, as opposed to trying to get waivers from them with respect to any type of COVID or vaccination issues. Policies for vaccine by job description. That's what I was talking about earlier in terms of, when you're rolling it out, if you want to make sure not all staff are getting the vaccine at the same time in a particular unit, maybe you want to not only stagger by unit who's getting the vaccine, but really consider which of your employees need to have the vaccine on a more urgent basis. For instance, I know Marianne mentioned earlier, you may have back office people, or you may even have a unit that's still working remotely because it wasn't necessary for them to be in the office. Or you don't have the ability because of space to have everybody back in the office. So you may want to consider that too in terms of deciding how to roll out or how to require that your employees be vaccinated when you're in a mandatory program. And even in a voluntary program, you want to take some of these things into account in determining how to address the situation and make sure that your staff is best protected while gaining access, hopefully, to the vaccine.
We had a bunch of questions come in, so, some really good questions. We're trying to get to as many as we can. Marianne, there were a couple along the lines of, and Lauren too, relating to, someone asked about, people might be wearing colorful badges, I think was the language used, or notifying managers of who got the vaccine and who did not. Can we just elaborate on that a little bit? What are your thoughts on putting a badge on someone?
Right. So, I mean, obviously that raises all kinds of issues, putting some kind of colorful badge on someone. But before I even answer that, I just want to make clear, as I mentioned before, there are some employers that are kind of doing a little bit of a polling to see who would take it or not take it, so that they can decide whether or not to mandate it or not. If you are doing a polling, it should be anonymous, and not ask the reasons why they would or would not take it, right? Because that's where you run afoul and get that protected health information. So along the same lines, sticking a colorful badge on somebody, which, just has, some other images swirling in my head that just seem wrong. But it also will, give an opportunity to say, okay, this person, these 5 people out of 10 have the indication that they took the vaccine. I only want to work with people wearing a badge. I don't want to work with the others. And there can be people who have legitimate reasons that they're not taking the vaccination. So that would set you up for some type of discriminatory or retaliatory claim. So definitely don't do that. And another question that came in along the same lines is like, well, if I'm interviewing people, can I start asking them about, how they feel about vaccines, and kind of weed out the anti-vaxxers, I think is what the term was that the caller had asked. And no, you got to stay away from that, because again, if you ask the question, how do you feel about vaccines, you can elicit an answer that gives the employees protected health information. So you don't want to do that. Someone else, and just quickly, Sal, and I don't know if you wanted to jump in, but another question asked about disclosing the COVID positive person. What happens? Can I do that? No, you still can't disclose who's COVID positive. You do your contact tracing. The person's out, you just don't talk about it. People may make an assumption who's COVID positive, but you don't validate it one way or another. The person's just out. And, the liability there, it could be from a discrimination and again, retaliation standpoint, is that if a supervisor sees somebody's out or that they were told that they were COVID positive, you can have either breaches of confidentiality going on, as well as, again, how they're treated from a discriminatory or retaliatory standpoint. So I think I answered a couple of questions along the way.
All great points. There was another general question about what are the penalties if you do disclose? And I think the short answer is you don't want to find out. There could be some significant penalties. The state and government agencies could be knocking at the door and asking, why did you disclose this information? And I think that can come with some fines as well, right?
Yeah, I think it can. I don't know them offhand, but I think the bigger issue is if the employee's COVID status is revealed, and let's say down the road or a week after they're terminated, it's really a damages assessment. And if they can link that, well, because they knew I was COVID positive, I was terminated, you have damages related to a discrimination claim, whether it's lost wages, emotional distress, and all that type of stuff.
Right. And Lauren, I saw another question related to the symptoms. If someone goes out sick with potential symptoms, is there a possibility for paid leave under the various programs? And it's a good segue because our next couple of topics are going to switch to that.
So the answer is that depends, and we should talk about the current leave laws that are out there. There's a lot of considerations as to whether that will be paid time. Are they someone that was in close contact with someone else and subject to a quarantine? If so, they may be entitled to paid sick leave. Are they someone who's seeking a diagnosis and we're still providing federal leave? Then again, maybe. So certainly there's an analysis that has to be done with respect to, what state you're in, whether you're still giving the federal leave, whether they are just symptomatic, and we know they didn't have any close contact, it's just from the vaccine, and whether or not maybe general sick leave would apply as opposed to some of the COVID specific rules. So there's really no yes or no answer to that. It's very case specific. And like you said, Sal, this is a good segue. The Families First coronavirus, the federal benefit that was out there, I'm sure most of you know, that expired on December 31st. And that was for the mandatory sick leave and the extended family leave to the extent that your child's daycare or school was closed due to COVID. Right now, to encourage employers to continue to give those types of benefits, the federal government has said through March 31st, any employer that continues to give those federal benefits will receive the same tax credit that you would have received before for providing that leave. So essentially the government is covering that cost to try to encourage employers to still provide that leave. And we know that may be difficult. We know that there have been staffing issues and shortages that have come about. But to the extent you can provide this leave, the government is certainly encouraging that you continue to do so by providing that tax benefit. We are expecting that there will be new legislation on this, and it's likely that due to the current surges in COVID, that the federal benefit may be extended again as a mandatory program, not just voluntary. And we're waiting to hear on that, and we'll be putting out an alert when it does come up. There's still also, like I mentioned, the paid sick leave. New York has the COVID specific leave if someone is quarantined. That's separate from your regular sick leave or sick pay or PTO. And in New Jersey and Connecticut, you can use your state mandated paid sick leave to the extent that you're quarantined or seeking a diagnosis. So there are various types of leave still out there depending on the situation for your particular employee. And it's important to consider those when people are asking for time off for COVID related reasons. There have been some recent updates also on the parameters of quarantine when you are someone who's been in close contact, and the parameters for if you're going to travel, some of the test out options that the states have adopted so that employees can, come back to work sooner than later when traveling. One thing I'd like to point out, though, that in New York and other states, there's a potential that employees won't be entitled to the paid leave if they're traveling and they were put on notice that if they unnecessarily put themselves at risk and they travel to another state, we'll go into the specifics later, but they may not be entitled to the sick leave at least to paid sick leave. They may be entitled to unpaid sick leave. And we're going to go through the specifics of that. So Sal, I'm going to ask you this question. So now we're not getting to travel yet, but just to quarantine. If I'm in close contact with someone who we know is COVID positive, right now in 2021, what are the quarantine rules? What are the changes that have been made recently?
So just when we all thought we had a handle on it, going into December, CDC issued some new guidelines, and they basically reduced it from 14 days, which had been pretty standard for most of the pandemic, to a 10-day period. And I think there's some underlying business and environmental factors to that, just getting people out there and getting back to work, that probably pushed that. And CDC also said it can be 10 days with no symptoms and also 7 days with a negative test as an alternative. Now, CDC specifically says, though, you need to consult with your local, state, county governments to determine, or departments of health to determine if they're going to enforce that. So we have seen some changes. New York, New Jersey, and Connecticut have all basically adopted the CDC guideline to one extent or another. And it's important to see the slight distinctions. Generally, all three have said it's okay to look to 10 days if there are certain factors, including people needing to go back to work. New Jersey and Connecticut specify it a little bit more in terms of those factors. New York just says we can look to the 10 days. But you don't just end it at 10 days, a little bit of a misnomer. The individuals still have to continue to monitor the signs and symptoms after 10 days, continue to wear masks when they're out in public. Of course, they're going to wear masks when you're in your workplace regardless, but when they're in public as well. This isn't about just going back to work. It's about being back in society. So you're going to have to continue to monitor it for days 11, 12, 13, and 14 and follow guidelines. New Jersey specifically limits this based upon zones and risk factors. So that's something to look at if you're in New Jersey. And the last thing I'll add is both New Jersey and Connecticut have adopted the CDC guideline with the 7-day test out. So you can test negative at the 7th day and then potentially get back to the workforce. New York has not specifically extended that testing out option for generally speaking. But that kind of leads us into the next point where, this answer might depend a little bit on what area of practice you're in, what field you're in. Certain healthcare employers are going to be treated a little bit differently under certain circumstances. And if you do have a situation where you can return to work early, because let's say you're a healthcare provider, in those specific situations, New York State at least has stepped in and said, you're going to have to follow a long list of requirements. You have to check your temperature daily. You're going to continue to wear the PPE and the masks. You're going to continue to check for signs and symptoms. And if you have any signs or symptoms, you immediately have to go home because we can't risk, exposure that way. And even to this, just New York's had that rule for a little bit now, but just recently, I think it was January 7th or so, right, Lauren, where they added to that requirement. And can you jump in there and let us know what that addition was?
Yeah. So the previous guidance that had been issued for healthcare personnel had a provision where if your employee was in close contact with someone who's COVID positive, but was asymptomatic, and you were going to experience staffing shortages if they didn't come back to work, there were certain exceptions where those employees could come back to work before the end of the quarantine period, those asymptomatic employees. However, New York has now issued, like Sal said, on January 7th, I think it was, a requirement that, first of all, employers that are going to be in those situations where they may face staffing shortages have to have staff mitigation policies in place to avoid those shortages. They have to show that they're doing their part to try to avoid those shortages. And the CDC issued the mitigation factors to look at, and you can find that the New York State Department of Health and New Jersey have both adopted those and said that employers should be following those mitigation plans. In addition to that, if you're an employer who says, I did everything I could, but we're going to have a staffing shortage, I need these asymptomatic employees to be able to come back early, you actually have to submit certain paperwork to the state. Whereas before it wasn't clear, could you just do the analysis and have a memo in your files that you look to see if there would be staffing shortages. The state has made clear you cannot take it upon yourself now as an employer to say, if these people go out, we're going to have a staffing shortage. So, we have to continue to allow them to work. There's actually now requirements for what you must submit to the state in New York in order to be able to potentially have those employees continue to work. So that's an important change that just happened recently.
And that's certainly subject to change, because the reality is the state's not responding as quickly to doing the contact tracing. So I could, at no fault of their own, it's just overwhelmed, I could envision a scenario where the state's not getting back to you for 14 days, and then that submission really wasn't worth the paper it's printed on. So we'll wait to see how that plays out, but right now that's the standard. The last question with respect to an employee actually testing positive, well, it's kind of been the same here. Isolate for 10 days from the onset of the illness, and then at least in New York, it's 3 days fever-free without medications. In New Jersey, we listed here, is going to be fever-free without medication for at least 1 day. So just, you're going to need to keep that in mind. People are all too quick to say, I did my 10 days, I'm going to go run around. Well, if you're not bringing people back to work if they're still having signs and symptoms. Fever in particular has been the biggest one. We're going to try to get through as much as we can here and get to some questions at the end. We'll touch on some other topics quickly. Travel, Lauren, just want to remind everybody of this, because this continues to come up, especially as people are itching to get away and just take a break and travel, but it's going to have some blowback for employers on how to deal with this.
Right, and certainly non-essential travel is certainly discouraged, but we can't prohibit employees from traveling. So New York, New Jersey, and Connecticut have all issued guidelines for test out options if you do travel, and you can see those there. New York has 10-day quarantine, but you can test out by testing negative within 3 days prior to traveling to New York, and then a second negative test on day 4 of your quarantine when you return. These rules don't apply if you travel to New Jersey, Connecticut, Vermont, Massachusetts, or Pennsylvania, the contiguous states. The government has said, it's really impossible. There's everyday travel between these states. It's impossible to monitor. But to the extent someone's traveling outside those states, certainly that's a way for them to test out and come back to work potentially earlier than the 10-day quarantine. New Jersey actually says you should consider getting those tests. It's not, they don't use the mandatory language that New York does, but Jersey says you should consider getting tested between 1 to 3 days before your trip and 3 to 5 after. One important distinction, even New Jersey, even if you're negative, you're still recommended that you quarantine for 7 days after your travel. And in Connecticut, again, more mandatory like New York, you're directed to quarantine for 10 days from your arrival in New York, but you can test out with a negative result within 72 hours of arrival to the state. So some nuances, and you can see there we also listed the exceptions. Each of those states says, there are certain states where we're not going to require you to do these things. Also, the states all have travel forms that individuals are supposed to fill out when they're traveling back and forth between states. The monitoring it, I think, has not been as great as we would hope, but employees are supposed to fill out, and all people are supposed to fill out those forms when they're traveling, out of state. One thing I just want to mention also, we're getting a lot of questions about employees traveling and then telling their employers they have to quarantine. And we've gotten a lot of questions about, we're not even sure where the employee really is. Maybe there hasn't been full transparency at times with problematic employees. Don't forget, you can always require your employee to get a quarantine order. If there's someone that's telling you, well, I was exposed and now I'm traveling, you can ask for, proof that they are actually quarantined, that they were in fact exposed. And we can certainly ask for proof if they're telling us, that they traveled to Vermont, which we may not require them as stringent obligations in terms of returning, but maybe on, another employee told us, well, actually that person was in Florida. So you certainly can ask employees for proof of, quarantine and some of these other things in order to confirm, where they've been and to mitigate the risk from, the spread in the workplace.
All right, and one of the final topics is just to quickly review this, and Lauren touched on a lot of it already, but I'll just quickly follow up. Leave pay, and this has continued to change and been something that employers are struggling to address and deal with. And the reason we want to flag it is because as we get up to the last topic, which would be employee discipline, you want to make sure you have your records in place. You want to make sure that you're providing the appropriate sick leave to individuals when they're out, for 2 reasons. 1, they're entitled to it, of course, and they should be afforded it. And 2, if at some point in time that individual is going to separate, you want to be able to look back and not have an outstanding claim that you didn't pay sick leave or that you paid too much sick leave and now you don't have the ability to say you're out of sick leave. We're going to continue to give more, how you document it. So Under the federal law, the FFCRA, nothing mandated presently. It's permitted, as Lauren said. Keep an eye out for that. State laws, you do have to continue to check under the relative state laws if there is going to be time left in each individual sick bank, and the states now all have, in the tri-state area at least, have mandatory policies one way or another. When people exhaust those leave options, they may also be entitled to other benefits, additional leave time that would apply. It might be paid, it might be unpaid, but you need to check and do an analysis to determine if there's some other leave option available. One distinction that we want to make here, healthcare providers, specifically in New York, it's funny how these things came out, but this was somewhat under the radar, which is surprising. In June, again, we were there and involved with it, but trying to roll out the messages as much as we can. Healthcare providers can get up to 3 paid sick leave entitlements, and the second 2 have to have positive results, but it's something to keep in mind. Department of Labor is enforcing that. So healthcare providers, again, in New York, may be entitled to additional paid leave requirements, and that's specifically under the emergency sick leave law that could provide anywhere from 0 to 14 days of paid leave related to COVID. So just something to keep an eye out for. The last topic, Marion, did you want to jump in with any questions there?
You know what, I thought you were done, but I was reading a few of the questions and I was going to give a few answers. So, but you could,
Great,
you know what? Oh, okay. So somebody had asked a question about, well, when do we tell staff about COVID exposure and, for protecting the staff? And you don't, right? So if an employee comes to you and reports that they're COVID positive, the contact tracing you ask the infected person, who were you with? Who were you sitting by? Did you have lunch in the cafeteria? Or maybe it's a small area that they work in. You identify the individuals that were potentially exposed. You contact those individuals and they'll have to stay home in quarantine according to the rules Sal and Lauren were just talking about, but they don't get the name of the person who was infected. Again, they might guess who it might be. And then the same inquirer also mentioned, well, people write it on social media. Well, you can't stop that. People can, relay that information. That's not your responsibility. You just can't perpetuate it. And then quickly, I saw a question about incentives and whether it's frowned upon or not. I think it could go either way. I don't think anybody frowns upon it, but keep in mind, I failed to mention before, if you offer an incentive, for people who have bona fide exemptions for disability or religious reasons, they're eligible to get that incentive as well. So they can't be excluded from the mix of getting that incentive. Sal, go ahead. I know you have one more topic you want to grapple with, and then if we have more time, we can answer some more questions.
Thanks, Marion. And just one basic thing, we've been getting a lot of questions about, can I discipline an employee up to termination for their failure to follow office policies related to COVID? The short answer is yes, but you have to be careful. What you cannot do is you can't terminate someone's employment, suspend it, or take any adverse action if it's because they got COVID or because they were in close contact to someone and now have to quarantine. People are going to be entitled to leave rights and the paid laws that we talked about under various state and federal laws, and you can't adversely make that determination. And the employees are immediately, and their attorneys that they're going to go to when they're at a barbecue or wherever they're hanging out and or talking to on the phone now, maybe they're not at barbecues or maybe that's how they got COVID, but they're going to have that discussion and they're going to say, oh, well, they fired you because you got COVID, let's sue. And we have a couple of those already that have happened. So what you need to do is avoid that. First and foremost, have a clear set of policies. Too many folks that we're talking to still don't have any written policies about what you must do when you return to work in terms of masks, social distancing, reporting your signs and symptoms on a daily basis. That's all important because that's something you can point to that's tangible and say, you didn't wear your mask. You didn't report that you had symptoms. You lied on your certification when you came into the office on Tuesday and told us you didn't have a fever, but you wrote on social media that you were feeling sick and thought you had COVID. Now we have something tangible to look to in terms of a violation of office policy. So that's going to be the most important thing. Again, be prepared for employee challenges, communicate your policies effective with staff. This is not the time to be silent and just wait for people to step out. Tell them what it is. Just get it out there. Here's the policy. Here's what you have to do. We're seeing a lot of this again with travel. People want to go and come back and not tell you what they're doing. Communicate the policies with respect to travel. If someone violates it, they'll have to pay the consequence. But again, Don't be too quick to just want to terminate someone. Go through this analysis to make sure you're not exposed in any way. Of course, each case is going to have to dealt with on an individual basis. You know, there might be certain circumstances, and this is why it's important to step back, analyze it, reach out to your HR reps, reach out to us, reach out to your attorney at Garfunkel who you deal with and say, hey, I have a situation, I'm not sure how to deal with it, because it's better to ask before than afterwards when we're dealing with a bad record or a record that's a little incomplete. So, with that, I think we covered.
Points out there was a question on travel. Someone asked, are there exceptions if someone is traveling for less than 24 hours? Yes, there are absolutely exceptions in the rules if someone is passing through and staying somewhere for less than 24 hours. Each of the states does have some exceptions there. So again, that's why, these are all of these issues have to be looked at on an individualized basis when we're asking, questions about specific employees. I also saw a question, do I need to pay someone who's on probation if they have COVID? If they qualify, certainly if you're in New York, if they have COVID, they would get the state sick leave. And, in New Jersey and Connecticut, they'd be entitled to use their paid sick leave. So the fact that they're on probation is really not the key factor. The question is, what are the available leaves in the state that you're in for someone who tests positive for COVID? I also saw a question, what if someone is taking time off to go get tested because they were a close contact? Well, again, if they were a close contact, then they would be in New York. If they were actually a close contact, you could ask for a quarantine order. They would be required to be quarantined and would be entitled to that paid time when they were out and, also seeking a test. Again, if you still pay the federal leave, someone seeking a diagnosis would also get the sick time. So it's really a matter of sitting down, figuring out, where you are, what the specific facts are, and which of these rules apply in order to determine the ultimate analysis.
All right, Mary Ann, did you see any other questions we wanted to address? I'm trying to look myself.
I know there were a number of questions. I know we're running close on time. I saw one about workers' comp. It was a more generic question about, could COVID, implicate workers' comp? And yes, I mean, particularly in the healthcare arena, when this first came out, and healthcare workers are exposed more likely than not to potential individuals, patients that have COVID. Ultimately, it will be a hearing before the Workers' Comp Board, but that is something that we are seeing where individuals can potentially get workers' comp benefits related to contracting COVID, particularly in the healthcare field. But I hear the other argument as well, they could have got it at CVS or when they went food shopping or whatever it might be. But it really is going to be fact specific. So if you're in an office where 15 out of 30 people got COVID, it's more likely than not you got it in the office than at CVS. So that will come into play.
Yeah, I did see a general question from an administrative standpoint. Can we share a copy? Generally, yes. The recording itself and the PowerPoint should be available in a day or two once we sort the recording features out. I think we have a YouTube page now where you can get access to it and rewatch it at that point in time, which would also give you access to the PowerPoint. You can see it again.
Well, I think we all thank you for participating today, and unfortunately, given the amount of time, there were quite a number of questions. We hope we answered a number of them, but if anyone has further inquiries, feel free to contact any one of us or the lawyer that you work with at Garfunkel Wild, and we're happy to provide additional information. It was a pleasure doing this today.
Thank you, everyone.
All right. Bye-bye.